All right. Would you please state your first name?
Hi, my name is Dee.
Hey, Dee. Okay, well, what first brought you into Palmetto Physical Medicine?
Oh, I was just miserable with back pain. When I would sit down in a chair, it was like a fine. But I'd get up, and it was just my lower back was causing me great difficulty. It was just walking across the kitchen was an effort until I could stand up. Getting up in the morning was a problem. One night, it really frightened me. I got up to go to the bathroom, and I fell against the wall, and I said, Dee, you have got to do something. This is interfering with your life. You are 70 years old, and your quality of life is really being affected. So being a retired registered nurse, I thought, okay, I have got to find someone who can help me. And what do I actually need? Am I going to need surgery? But I need to consult someone, and I thought I really need to bring my walker up at night so that I don't fall, because I just didn't trust myself. So I saw an advertisement in the Greenville newspaper about Palmetto Physical Medicine,
Okay.
and I thought I'll attend that conference and see if they may be able to help me.
All right. Well, what was the severity of your symptoms when you first came in, 0 to 10?
I was very aware of the back pain, and it was, I would say, most of the time when I get up from a chair, it was a 6 or 7, and it was just where I don't like to take medication because everything has side effects. So I thought, I do not want to start with being dependent on Advil or some Tylenol medication. I want to be able to get through this, and whatever I need to do in the way of physical therapy, I'm willing to do, because this is my life.
Outstanding. Well, you talked a little bit about how it affects your daily life. You talked a little bit about getting up in the morning, how difficult it was just walking across the kitchen. What services did you get here to address your problem?
Well, when I came, understandably, I didn't know quite what to expect. But I have never been anywhere where everyone knows what they are to do, and the internet connects each person. So if I say something, everybody knows what is happening that day with me. I don't have to repeat myself. When I come in the door, I see Leah, and it's like, hi, how are you? Smile, happy to see me. Hannah, great gal. She just looks like she came right off the ship from Sweden, which she is from Sweden.
Mm-hmm.
And Dr. Martin, the physical therapist, the chiropractor.
Mm-hmm.
I'd never been to a chiropractor, so I was apprehensive. He has done a remarkable job. I wouldn't be nearly as good today as I am without all of your help. Dr. Martin, the physical therapy department, Julie, great. She sat down, she went over what she felt I needed. I came 3 times a week. I started in December, which is one of the most hectic months of the year, but I said, priorities. I have got to take care of Dee. And I didn't know how much worse I'd become. And I said, I've got to do this. So even though I live in Salem, South Carolina, it's a good 50-minute drive 3 times a week. I said, this is important. So I made the effort, and I couldn't be happier.
Well, thank you. You made the effort, you made the commitment. That's a big part of what we do here, because you're a part of the team when you're coming here as a patient. So with all the effort and everything you went through, what would you put the severity of your symptoms now that you've gone through a program and seen improvement?
I am so much better. I never thought that my back would feel as good as it does now. I'm able to get back to life. I will now be 71 at the end of this month, and I feel definitely I have more energy. I am not in pain, which is wonderful. I'm able to walk our leisure trail 3 miles, which is great. I try to do that every day. I'm able to get back to pickleball, tennis if I so desire, yoga lattes. My housework is not an effort. I was having an awful time, like just making the bed, tucking in the sheet and the blanket, and then standing up again. And I thought, oh, is this what old age is like? What am I going to be like as I get older? So I'm like, wow, I have a new lease on life.
Outstanding, outstanding. Well, you talked about how it's changed your life. Would you recommend Palmetto Physical Medicine to your friends and family?
I tell everyone, I said, without Palmetto Physical Medicine, I would not be here today in the sense of being able to be involved. And I do wear, probably for the rest of my life, which is fine, I wear a 6-pound weight on my head in the morning, which Dr. Martin, I worked my way up. And so I do little readings the first thing in the morning. I put that weight on, as he told me I'm supposed to do, and it helps my neck be aligned with my spine better. So it works.
Outstanding. Well, thank you so much, Dee. I appreciate it. That's all we needed.
Okay.
Thank you so much. That was great.
All
That was
right.
great.
Terrific.
Thank you.
Well, it's the truth.
Yeah, thank you so much. Can I get a hug?
Sure. Oh.
If you haven't noticed, I like hugs.
I'm a hugger. I'm a hugger. A hug is the best.
Oh, yes.
The best of all.
Yes, best thing in life is free.
That's right.
Now, I'm going to get you back on home. I should probably sit you down to wait for your massage. Well, come on in. I know you want to talk to me, so let me get you into my office here. Sorry, I had one more appointment to wrap up before I got you. Oh, just have a seat there.